Welcome to another video. In this video we will continue learning the respiratory system and learn tuberculosis. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis and transmitted through aerosolization. The contributing factors include older and homeless populations, lower socioeconomic status, foreign immigrants, and those in frequent contact with untreated persons. You may be wondering, why are these the contributing factors? Let's think about it. The key is transmission through airborne settings. Those with poor living conditions will live in smaller spaces with multiple people. For example, shelters are an ideal setting for this airborne disease. Now let's discuss signs and symptoms. The patient may present with cough, hemoptysis, have a positive sputum culture for acid-fast bacillus, low-grade fever with night sweats, anorexia and weight loss. Note that hemoptysis is coughing of blood. The common diagnostic procedures for tuberculosis are the following. Mantoux. Sputum culture and smear for AFB to confirm diagnosis. Serum analysis such as the quantiferin gold test. Chest X-ray. Nursing interventions for tuberculosis include the following. Initiate airborne isolation precautions. This is crucial. Prevention of spreading the disease is a priority. Obtain sputum sample before administering medications. Maintain adequate nutritional status. Inform the client that the medication, rifampin, can alter the metabolism of certain other medications. Monitor laboratory findings for liver and kidney function. Medications. A patient that has tuberculosis will have a strict medication regimen. This is frequently mentioned on exams, so keep this in mind. Medications include the following. Isoniazid, which is also known as INH. Rifampin. Pyrazinamide. Ethambutol. Note that if the patient's TB shows resistance to anti-TB drugs, fluoroquinolones and aminoglycosides will be administered instead. Client education will include instructing the client to follow infection control measures, teach to ensure medication compliance and follow-up care. Now let's learn about laryngeal cancer. Laryngeal cancer are malignant cells occurring in the mucosal tissue of the larynx, which is also known as the voice box. This is more common in men between the ages of 55 and 70. Laryngeal cancer is part of a group of head and neck cancers. Every year, approximately 13,000 people in the U.S. are diagnosed with laryngeal cancer. About 3,700 people die from it each year. The contributing factors include the following. Smoking. Radiation exposure. Chronic laryngitis or straining of vocal cords. A patient with laryngeal cancer will present with hoarseness, dysphagia, dyspnea, cough, and persistent sore throat. Diagnostic procedures include the following. MRI. Direct laryngoscopy. X-ray and CT scan. Important nursing actions when caring for a patient with laryngeal cancer include the following. Maintain patent airway. Maintain swallowing precautions. Provide emotional support. Anyone with affected breathing will be extremely scared. The two common therapeutic measures are a partial total laryngectomy and radiation therapy. Post-surgery client education includes deciding on a communication method, providing stoma care, teaching swallowing maneuvers and encouraging speech therapy. That's it for this video. In the next video we will continue the lesson by learning about lung cancer. See you there.